Welcome back. I hope you've all had the chance to grab some fresh coffee and are ready for the last session of today's conference. The theme for the last hour is the use of digital solutions and welfare technology to solve the welfare challenges that we have talked about today and that many parts of the Nordic countries are facing. To get us started with that, I would like to welcome Anna Lundgren, who is a senior advisor at Norregio. Hi, Anna. You will share with us some of the main findings in a new Norregio report on digitization of healthcare and social care that I know that you're working on with quite a few others, and that was also mentioned earlier this morning by the General Secretary from the Nordic Council of Ministers. So, Anna, we're looking quite much forward to hearing some of the highlights and some of the main findings of the study and what we can learn from that and how we can use the new digital tools and welfare technology to, if not solve these problems, then at least change the way we work and perhaps, for the better at least. The screen is yours. Yeah.
Now we'll see. Can you hear me now?
Yes, we hear you loud and clear now.
Thank you so much. So thank you for the kind introduction and for letting me share with some of the results from our project that we have been conducting for the past 2 years. And this project has been part of the distance spanning solutions within healthcare and care that has been funded by the Nordic Council of Ministers. And if we switch to the next slide, please. So this is the cover page of the report that was presented only a month ago, and we can switch to the next page. Next slide. So the topic in this report and in this project that, just as Morten said, has been conducted together with a number of colleagues from Norregio is what are the regional development effects and obstacles and potentials of using digital healthcare and social care. And to this end, to explore this question, we did case studies in all 5 Nordic countries and also case studies in the Faroe Islands and in Greenland. And in each spot, we explored 1 region and 1 or 2 municipalities. And you can see from this map which case study regions that were selected. So it was South Karelia in Finland, it was Västerbotten in Sweden, North Jutland that we've heard of today already, it was Sognefjordene in Norway, and it was the Northeast Health Region in Iceland, and then 2 parts in the Faroe Islands and in Greenland. And when we talk about the regional development effect, so the regional development impact, by that we mean both economic, social and environmental impacts, and in what way digital solutions in healthcare and care can actually contribute to regional development and sustainability. Next slide, please. So what do we mean by digital solutions in healthcare and care? We've learned a bit already today, but I will bring forward here 3 types of digital solutions. Well, the first one is video consultations that we have come to learn more about now during the COVID-19, where the increase in using video consultations and seeking health information on the internet has increased very much. And video consultations, as one nutritionist here from Västerbotten says, is first and foremost, it's about flexibility and accessibility. And this may increase accessibility not only for patients to doctors and nurses or nutritionists, but also for healthcare staff and for practitioners. It may also increase flexibility when you can access your doctor or a nurse remotely. And this is not least important for those patients that are obliged to meet with healthcare professionals quite regularly and quite often, such as those with chronic illnesses. And in this way, this provides a greater flexibility. It also has a result as it may contribute to tackle some of the recruitment challenges that we've heard with this accessibility and flexibility for healthcare personnel. Perhaps not to go to the office every day or to the hospital, but work remotely from distance a couple of days a week. That was also something we saw and found in our case studies. And then finally, of course, these video consultations can also contribute to increased well-being by those advantages of being more flexible and accessible. And if we move to the next slide. Thank you. So another type of digital solutions are the digital meetings that are found within healthcare. And this means that doctors and nurses can get access to specialized professionals within the healthcare sector and knowledge sharing between peers. So especially in the remote areas, there is no possibility of having all the specialties within the hospital. So in that case, the digital meetings within healthcare can provide those specialized competencies that can then be accessed remotely. And this, of course, improves quality, and it also leads to less traveling. If we can access those special knowledge remotely, we may have to travel less. And this can, of course, improve both quality when we get access to specialized competence, but it can also improve efficiency by reduced traveling. So next slide, please. And then a third category of digital meetings that we bring forward here today are the passive warning systems that are found in elderly care. And these are sensors that are used to detect irregular movements among elderly, especially during nighttime. So that may help, the installment of these sensors may help healthcare personnel from distance to monitor elderly from distance to see if someone has fallen out of their bed or have gone to the bathroom and doesn't come back in a certain time limit. And this, of course, then offers these digital solutions the possibility for many elderly to stay home longer, as it improves safety, and it also improves the quality of the care. And it may also lead to less traveling for home care services. Other common examples of digital solutions in the healthcare and especially in the elderly care that we found was the use of alarm watches that are frequently used, but also other digital solutions in the elderly care. So if we move to the next, please. So in our study, in those case study, we find a number of effects and potentials regarding the use of digital solutions in healthcare and care. And these effects and potentials, they refer to 4 different areas that are quality, efficiency, inclusion, and accessibility. So as I have mentioned already, one of the impact is the less traveling, both for patients and for social care workers. And I have also mentioned the access to the specialized healthcare, the flexibility for patients and for healthcare professionals, and the potential for improving recruitment that we have heard a lot about today in the conference. And of course, this may also improve the well-being and the feelings of safety, both for patients and for citizens, and not least for relatives to elderly who have their old relatives living in remote areas. But we also find a number of obstacles. And if we move to the next picture, please. Thank you. So we also find obstacles in a number of areas, such as, for instance, a lack of change management and digital skills in the healthcare sector and elderly care sector. We also find issues regarding data security and patient data legislation. This was found across all countries, basically. From the healthcare personnel that we interviewed, we also found evidence for lack of interoperability of data systems and lack of user-friendliness and adaptability of these digital solutions to the individual patients and to the individual situation in that area or in that organization. In some instances, we also found a lack of economic incentives and resources. And a lack of economic incentives may, for instance, mean the lack of well-organized reimbursement models for practitioners to actually perform data and video consultations. But also a lack of resources, and that is both economic resources, but also lack of time to try out new digital solutions within the healthcare sector. And then finally, one area of obstacles relate to culture and to healthcare ethics. And to acknowledge the acknowledgement that digital healthcare is also considered as good healthcare, and that it should be considered as good healthcare as well. And then finally, lack of interest was also found in some of the case studies. So to summarize, the obstacles relate to leadership and management. They relate to legislative obstacles, to technical obstacles, to economic obstacles, and to cultural obstacles. Of course, these obstacles are something that are important to also pay attention to. And if we move to the next slide, please. This is also part of a study where we did accessibility studies to compare the access to physical digital healthcare. So those maps illustrate the accessibility to outpatient primary care is the example here. I will show you two examples. So this is an illustration of the geographical accessibility. And this is what is shown here is the road transport time from residence to outpatient primary care. And outpatient primary care is where you make a doctor's appointment or you can meet your general practitioner. And in the case study regions, we found here also illustrated in the maps a difference between 10 minutes up to 2 hours. And the more purple the color gets in the maps, the longer the distances. And we can see that the distance to outpatient primary care is also an effect of how the healthcare system is organized and how many healthcare premises there are actually, and that differs quite a lot among the regions. And what we can see here is that our primary outpatient care can be reached within 10 minutes. From Denmark in North Jylland, 99% of the population can actually reach outpatient primary care within 10 minutes. And all regions can reach, in all regions, we find that 80% of the population can reach outpatient primary care within 20 minutes. But we also find large differences. And as you can see, the most purplish areas are found perhaps in Sognefjordarna and Eastern Health Region in Iceland. And that is also a result of the mountainous areas, which of course implies long car driving distances. And if we move to the next slide, please. That is an illustration to accessibility of inpatient care, that is hospitals. And here we find that in 30 minutes, 80% of the population in North Jylland and in Västerbotten and in South Karelia can reach inpatient care within 30 minutes. But again, in Sognefjordarna and in East Iceland, less people can reach inpatient care in those timings. So as a conclusion, it is especially in the rural and in the remote areas that the largest potentials for increased accessibility to healthcare is found. And if we move to the next slide, just very quickly, we have a demographic challenge and we see the aging population. I'm sure you have heard a lot about that already today. And this map here illustrates the outmigration of young people, where red means a negative outmigration of people overall. But we also have some evidence of young people moving back, and that is very promising and something we should look more into. And next slide, please. And the second challenge that I would like to raise is the digitalization challenge, where digital solutions in healthcare and care are dependent on the access to internet and to broadband. And despite very ambitious goals of super fast broadband to all the Nordic countries, as you can see here, we still have a way to go before we have reached that target. And we can move to the final, this is not my final slide, but here are some more examples of distance spanning solutions. So we have the digital health platforms existing in all the countries that are very important in this context when it comes to data sharing. But we also have other examples that you can read more about in our report about virtual health rooms in Västerbotten and mobile clinics used in South Karelia. And then final picture. To sum up, I would say that digital healthcare and what we found in our study and social care has the potential both to improve quality, efficiency, inclusion in healthcare and social care, and also, as I have shown here, to improve accessibility, especially in the rural areas. And this, of course, may benefit not only health, but also well-being and welfare, and contribute to economic, social, and environmental development and sustainability. However, in order to release those potentials, the obstacles also need to be addressed. So thank you for listening.
Thank you very much, Anna, for being with us and for sharing this results and these insights into how it actually looks and the differences. Thank you very much for that. Before we move on, I'm quite curious to hear from all of you participating here today and how you see the situation and how you use new digital solutions and welfare technology to actually deliver and create welfare in scarcely populated areas. So I hope that while the transmission goes on, that you will take a few minutes to actually share with us some thoughts, some comments, some examples in the chat. And while you do that and share some of your experiences, then I have the pleasure of welcoming Niklas Forsling, who's a project manager at Glesbygdsmedicinsk Centrum, the Center for Rural Medicine in northern Sweden, that was also just mentioned briefly in this presentation. And Niklas is actually with me as the only presenter today. Niklas is with me in the studio here at Folkets Hus in Stockholm, and he will share some insights into how digital transformation can actually improve the situation for workers in healthcare and social care, also in the scarcely populated area. So welcome, Niklas. And not only the screen is yours, but also the stage is yours.
Oh, thank you very much. Oh, Yes, my name is Niklas Forsling. I'm happy to be here. Thank you for inviting us to speak on this topic. I am working for Center for Rural Medicine. This is based in Region of Västerbotten, in the inland of Region of Västerbotten, in Storuman, a small municipality, 6,000 people living there, less than one person per square kilometers. We have around 150 kilometers to the nearest hospital, local hospital, 350 kilometers to the nearest specialist hospital. So we are in a very remote area. We work with research and development to actually provide better services for sparsely populated areas. We're also here because we are leading a project called Healthcare and Care Through Distance Planning Solutions together with Nordic Welfare Center. And in that context, we have got an additional assignment called Impact on Competence Provision and Organization. I'm going to now give you a pre-peek on the findings that we have from that work that we have done. The first question that we have asked us is, can digital transformation improve the situation for healthcare workers? We're going to tell this story by outlining 3 different strands. First, the problems, then the stories, and the way forward. First, the problem. How do we make sure that we have staff we need to be able to provide healthcare and social care of great quality now and in the future? I'm going to describe this by addressing the problem then. The first challenge is the demographics. You heard about it so many times today. We're getting older, etc. More services are needed, especially in remote and rural regions. And in Norway, they are saying that if we continue to provide the services this way, 1 out of 3 people in the entire Norway need to work within healthcare and social care in future. Budgets. Cost increasing while service provision demand is peaking. But it's not only that related to budget and digital transformation. It's also the risk that we take and the complexity to actually transform a service model. And the one big question mark that remains, how much does this cost, the financing? No one really have a clear answer of that. And this is a challenge that we have to cope with. Work, of course, workload is increasing. More hands are needed. But a major management task is actually to explain to the workers why do we need to change the way that we're working and what does this mean for the different professions within healthcare and social care. Recruitment. Recruitment has for ages been a challenge for remote and rural regions. Social care and healthcare professionals of different kinds are constantly being understaffed in many of our municipalities in my healthcare region. And this is then especially true in remote and rural municipalities and regions. When it comes to retainment is a little bit similar to recruitment, but retaining people within the job is a key priority for many of these rural regions. What we often see is people coming from other areas, moving into the rural regions, starting their career and move back after a short while. And this is something that we have to take into account when planning this in future. But what you understand from what I'm saying is that you can't only work with demographics or retainment or recruitment. You have to embrace all this at the same time. This is a very multifaceted challenge that we have in front of us. We need radical improvements. And the question is, can digital transformation help? So the story is part 2. What we've done is actually we've made 15 interviews in Eksot in Finland, Sogn and Fjordane in Norway, and North Jutland in Denmark. We have identified 4 main insights from these interviews. So the first main insight is digital transformation can make the job easier and more flexible. What we are seeing is that when working with digital solution, some of the tasks that have been earlier on the tables of the nurses and doctors and other staff within social care and healthcare have now been automated. The population is actually providing the services themselves, and the technology has made the job much easier. The second insight, digital transformation can give staff more time to what is important. comes with more, when you get more time for what is important, and when the work becomes easier and more flexible, then you can give priority to what is really needed. You can use your own skills to actually devote the time for physical meetings when that is necessary. And you can actually become a greater doctor, a superhero nurse, by actually using digital solutions for healthcare and social care. The third insight, greater meaning to the job. If we get an easier job, more flexible, and we can devote the time where it's needed, it creates a meaning to the job. And the meaning of the job is that telemedicine, for instance, have added greater meaning and value because they see that the solutions are of great importance to the citizens. When we come down to the ground and interview the people working with the citizens across these regions, we see that they jointly are saying that the citizens are actually appreciating these solutions. So it's actually a win-win situation. The staff can do more what they are intended to do, and the citizens are appreciating the greater service level that they get. The fourth insight and final insight is increase the status of the job. Maybe this is not coming that clear out from the different interviews that were made, but what we see regarding the increased status is that the management level are putting a lot of trust into this. Of course, some of the workers are saying this, and we see that workers are thinking differently about service provision and what type of new services they can see in future that could be provided through distance planning solutions. So telemedicine is a way forward, which is jointly for profession, but maybe currently more on a vision level of the management of healthcare and social care institutions. So these four insights give a simple conclusion that we see from these 15 interviews. Digital transformation can improve the working environment for medical and social care personnel. What we have done is we have tried to look into this. What is the message that we should give? Well, digital transformation is the key to create a good working environment for healthcare and care personnel. So social care and regions, social care organizations and healthcare region organizations that are being transformed, they have an opportunity to make it better for their staff working on a daily basis in their premises. But this is not one political field that is affected. There are multiple sectors that are affected and many ministries that are involved. And this is something that we need to keep track of and make sure that the ministers from different ministries are responding to this change that is needed. The way forward, the final part here. Our main message to all of you is listen and learn to those who learn from those who have succeeded. Exote, mentioned by Anna Lundgren just recently, is a healthcare region consisting of 9 municipalities forming one joint social service and healthcare region, established 2010, and they are maybe the leading the path forward for many regions to come. The situation was, as I explained earlier, increase in the elderly population, the same staff have to meet the needs, potential loss of their regional hospital. So the solutions, what they choose to do is a far-reaching organizational change, regional cooperation at all levels, joint social service and healthcare region developed, and they wanted technology support all the way across. And the vision they took, functional ability at home, meaning patient-centric care, holistic approach with heavy emphasis on digitalization, knowledge management and coordination, let as many as possible to stay at home of the patients, and they even rebranded patients to customers. So that's a vision to look at. You saw the cars, that Mulla cars that Anna Lundgren showed in her presentation. That's one way of moving healthcare closer to the citizens, driving around in the 9 municipalities in Exote from the hospital. Digital approach, first approach. What they are doing is everything that can be self-monitoring or be self-care are moving into people's own homes, so they could actually take care of themselves from their own living room. They also use very innovatively a regional data pool, collecting data from social care and healthcare, collect this into a data lake, and they use this data lake to get a ping when someone is starting to have a measurement that is going off track, so they could make an intervention long before healthcare is needed. This is actually well-being. It's preventive care. They engage the entire society, community engagement. It could be a football association that are helping designing a training program or a cooking course or whatever. So it's a complex system, but it's a very engaging system for all the citizens. So the story effects, very short. Management system has been a huge help. No paper, no paperwork. Everything is electronically. It's much easier. You heard it before. And the fear of digitalization would decrease the work, or maybe take away some tasks for some personnel. That's gone. They are working more with physical meetings, and they do more of the tasks that they are designed to do. Employees have a constant need for self-development, lifelong learning. They upgrade themselves constantly. The prestige in the profession increases. And recruitment is easier, at least for some professions, but maybe not for the specialist healthcare and social care professions that are needed as well. They see, and this is interesting, by using this, they see the reduced sick leave at the same time as they see increased work efficiency. The meaning of work has increased. Digital solutions have helped with staff shortage. So it's an attractive competitive factor for Exote to work this way. Maybe they are not branding this good enough, but it's definitely a factor that is standing out. So back to the problems, the stories, and the way forward. Problems, clearly, urgent. Stories, promising, listening to the interviews. The way forward, action. Our strong advice to you that starts to develop your healthcare region and social services. Look into the ones that are leading this development. In our case, we're going to provide you with the next 4 years of different examples of model areas for integrated healthcare and social care. And this is something why you should follow us. And you should also go into our webpage and follow us when we publish this Exote playbook and other information that has just been shared with you now. So thank you very much for this, and I give the floor back to you, Morten.
Thank you very much, Niklas. Thanks for sharing this with us. You will be here, continue to be here in the studio for a little further. Then we will get back to you in a second. Some of the last points that you just made, Niklas, are from Exote in Finland, and you also base part of your research and your presentation on practices and experiences from Sogn og Fjordane in Norway and from Nordjylland in Denmark. And now we are pleased to be joined by representatives from these three regions, by Ann-Kristin Kleiven, Development Director at Velfærd in Norway, by Helen Hormøller Rasmussen, General Manager at Telecare Nord in Denmark, and Katja Rapisjärvi, Development Manager in Exote, Finland. I hope I pronounced your names almost correctly, and if not, that you will forgive me anyway. Welcome to all of you. First of all, I'm curious to hear your perspectives on the first and the main question that Niklas also raised in his presentation, that how can digital transformation and new digital tools, how can it improve the situation and the work environment for healthcare workers? What are your experiences, Katja or Helen?
I can start. So in Exote here in South Karelia, Finland, we have done a lot of work with that because we live in rural area and the challenges are here right now. So we have tried to find the solution because our vision is that we provide services to home and of course we can provide face-to-face services, but also services remotely. And for example, in home care, we have done like last 5 years work to also provide home care services remotely. And nowadays it's 10,000 visits per month what we do remotely in our region to elderly people who need home care services. And of course, this have some cases helped also the recruiting to new healthcare staff, because some are really interested technology and use that, and of course some have some problems, so they cannot work really to do the face-to-face visits, but remotely it's possible for them.
And I would like to get back to that in a little while. But first, Helen, if we move to North Jylland, what are your experiences with how digital technologies and welfare solutions can change the situation and the working environment for healthcare workers?
Well, in North Jutland, we have succeeded in implementing home monitoring for patients with COPD and with heart failure. And what we hear from the healthcare professionals is that they experience great satisfaction in delivering this kind of healthcare job-wise, because they see a tremendous benefit for the patients in this. To my knowledge, we're not using it actively in recruiting healthcare personnel in our sector. So I think for sure we have a potential here. And I think in doing so, it's really important that we emphasize the value and the benefits digitalization can bring to our patients. And as Anna said, digital healthcare is also very good healthcare. So that is the message we have to use when recruiting personnel to these tasks.
And if I understand you correctly, it's not only that your employees or the employees actually work with these solutions, but also use them to actually reinvent or redevelop the way that they produce the services.
Yeah, they do deliver healthcare in different ways because they experience that they can reach a lot more patients by using these digital services before compared to earlier situations. Yes.
And Christine, how do you see it in Norway? Can you see that is it the same situation that the employees in the healthcare sector are positive towards these new technologies and are eager to adapt and use them in reinventing their services?
Overall, the young people are very positive, but also we struggle with the old structures and the old organizations and the old educational system. But I think mainly they come after, all of them now, and we have a lot of possibilities, and we have a lot of young people using this to innovate the services. For instance, we have now a physiotherapist who has made an app for lung patients that can help both the patients at home and also their helpers out in the primary care. So if we allow the workers to use their knowledge and to cooperate with the other professionals outside the hospital, we have a lot of possibilities. And we see that this creates some startups, some things that we never had thought of before. And also the patients are very happy to get help by distance, because we tested it very much now by the COVID, and they were very happy for it. But the system is made that after the COVID is not a problem anymore, it goes down. That is the challenge now.
But I guess it's a really good story, this thing, that it's not only about adapting and taking in the new technologies in the existing facilities and in the existing way of working, but also using them kind of beside the everyday job to actually develop new ways of providing services and providing care.
Yes.
I think Niklas, he had this picture that the technology is also a way. You mentioned an app now. It might also be a way to make some of the easier tasks digital, and then I think Nicholas used the picture of being a superhero nurse, because you can focus on what is actually like most important, and where you use your abilities to the full scale. Is that something you can recognize as well in the Norwegian health system? This thing that we can actually use the new technologies to take away some of the easier tasks and then let people focus on what they're really, really good at.
Yes, that's true. We use a lot of feedback forms, digital communication. The patient can do themselves at home, and then we can talk digitally to the patients at home. They don't have to come to the hospital so often anymore. So, and then the doctors can use their skills much more concentrate, so I think that is a very good part of it, to sell it to the professionals.
Katja, I know that you have some experiences, and you touched upon it briefly before, about actually retaining staff in care jobs, even though they've had, for example, serious back problems or something else that means that they cannot be in the physical facility or cannot provide the care in the same way as they did before. But they might still be able to use their skills and competencies on digital platforms. Can you elaborate a little more on some of these experiences and how you use technologies to keep competent workers in the care jobs?
Like I told before, in home care, this is more than true that there is a lot of nurses who have done the normal home care work earlier, and then they have some problems and cannot work on the field anymore, and those cases we have find the solution, and they are working remotely, providing the home care services that way, and that has given us one new way to provide services, but also keep them at work instead of otherwise they will be at sick leaves, and that is not efficient. So that has given another way to give them that kind of work what they can do still, and they are still nurses, so they want to do nursing work, and that has helped us a lot.
Helen, is that something you have experiences with in Nordjylland as well, actually using these technologies to use good skilled workers to actually stay in jobs, even though their physical abilities might not still be fully up for the job in the traditional way? Vi skal bare hoppe på det. We just need a little time to get the sound on.
Sorry.
Okay, no. Yeah, you were muted for a second. Just please, do you also use these technologies to actually keep people working and use their competence, even though their physical abilities might not be as they were once?
As I said, I'm not aware that we are using these technologies in this way, but I'm sure that with all the experience we've gained from COVID-19 and personal being able to work from home, this is perspective we have to look at, trying to keep personnel at our job market.
Perfect. And now that I have you, Helen, you said before this the fact that you perhaps haven't used all these positive stories and the positive examples that are actually there. The fact that the work environment has changed. The fact that you are very good at actually using new technologies in Nordjylland. But I get it from you that this might be something that you should develop further and actually use more proactively when recruiting and creating these pictures that the work in healthcare and care is not as it was before. What are your thoughts on this?
I think this is very necessary for us, because in the future all digital services should be the first choice. And will be an integrated part of how we deliver healthcare. So I think this is something we have to look more into. And a driving factor for doing this is gaining experiences in a small scale and scaling up to a larger scale. And then I think we will manage doing this. What we see with the nurses working in our programs is that they experience very much a greater prestige doing these jobs and working in this area. So we have to keep on supporting this and using it in recruitment of new personnel.
Katja, it seems as you in Exoday has been working on developing these new and more digital approach for quite a few years. Is it something that you use in Finland to try to recruit new employees and new professionals?
Some cases, yes. Of course, we have, for example, recruited some doctors who mainly work remotely. They want to live, for example, in Helsinki or bigger cities, and they work remotely. For example, we have psychiatrics, it is really difficult to recruit here, and they provide all the services remotely nowadays. So this is one option, because these rural areas, the recruiting is hard.
But can you recognize the picture that Helen also draws, that this is something that you can use even more and actually promote even more actively, that this is an option and this is how you work?
Yes, we have tried to make the positive or tell positive way that technology is part of the your work, and also that you can develop your work and use also technology more and more. But like was it Anna-Kirsten which says that of course we have also professionals who are not keen to use technology at all.
Of
so
course, yeah.
We need to balance between these things. But
so not an either or. And Christine, if we move to you in Norway, how do you do to promote the new way of working and using it in attracting new people to the welfare professions?
I think we use it in recruitment, but not enough. I think that is quite a good idea to do more, and we use it in the media to tell how we. To tell the patients, to the people, how we work differently now that they are able to talk to us even if they are at home. So we try to make it known, and we recruit other professionals, and we recruit remote, like Katja says. We have, for instance, the
dermatologist.
He's working only digital from another part of the country, and he takes on the waiting lists away from the other doctors. So we have tried quite a bit these things.
But I guess it's also a good point that it's not an either or, that some doctors in some specialties might work in one way and then others might work in a different way, and it in that way that we can still deliver the services and care without necessarily doing it in exactly the same way. Several of you mentioned the fact that we are now in the middle of a pandemic, which is also why we are transmitting this conference in this way. And I guess it's fair to say that all over the Nordic countries, we've seen a surge in the use of digital technologies. We've seen a surge in distance spanning solutions, in working from home or from elsewhere. What are your thoughts on this? How do we keep some of the good experiences from dealing with COVID-19 and working more from a distance? How do we keep that and use that in developing the healthcare system even further, also after we've hopefully left this pandemic situation?
I can try.
Sorry.
Thanks. Please, Anna-Kirsten.
Yeah. I think that we have talked about it a lot. We have to sum up what did we do during the worst period of COVID, and how is the strategy further on now. And we have to address the fact that the people are thinking, now we are going back to normal. No, it's a new normal we are going to reach. and that is not in the minds of everyone.
So
that
that's
is
what some are referring to as building back better. The fact that we not only go back to where we were before, but actually evaluate and find these solutions that we need to keep and use also after.
Yeah, because it gave us a boost in a development that we have planned for a long time, and now we have to keep it that way.
Helen, how do you look on that, and what are your thoughts on keeping, also from a managerial point of view, keeping focus on these good experiences and keeping them alive also after?
I agree very much with Anna, and I think from a management point of view, I think we have to very quickly, to keep momentum, be able to form the vision for this and to agree with each other. How are we going to work with this in the future? How are we going to maintain the experiences we have gained from during COVID-19? And I think we have to pick up all the positive patient stories because what we see and have seen in some wards at hospitals, this has been done out from necessity, but they have gained positive experiences in doing this. So we have to keep on moving on this path.
And just to keep you up on this, because I think this is really interesting, also from a managerial point of view. We are in the middle of the second surge of this pandemic. Everybody are running really fast, not least in the hospital wards, to just deal with everyday life and everyday patients. But the risk, I guess, is that if we don't collect the good stories and the positive experiences along the way, there's the risk that we actually lose in it, that it's hard to find them again after we have gone back to normal or something else. How do you see on what we can do, also from a managerial or management point of view, to collect these good experiences while everybody are running as fast as they possibly can to just fix the everyday job?
No, of course, this is a balance.
Yeah.
I'm sure, but you have to make time for it, and you have to. It has to do with a lot of visibility and I think patients will ask for these kind of services. So if we are going to honor the patients because they have experience, it's much easier to do a video consultation at home within few minutes maybe than going to the hospital and spending a whole day. So patients will ask for these services.
So there will be a rising demand. Katja, is that, do you share the same picture, that we will see more and more patients expecting to receive care and to have the accessibility through digital channels more and more in the future also?
Yeah, I share that vision, and for example, we have here in our region this kind of e-service platform, and we have half of our citizens using that platform already, and I think it's quite high %. So we can see that e-services are more familiar and they are more keen to use these kind of services at the moment. And but I'm also thinking that COVID-19 has this make it easier for the professionals. They have take the first step now and start to use the different kind of remote systems, and now the next step is more easier for them. They can continue now, and they have seen that also the customers and patients, they survive and can use these kind of systems with them. So I think many cases professionals are more negative than the patients are.
Niklas, you're still with us here in the studio in Stockholm. You've studied all of these 3 regions and have now been listening to the discussions here. Are there any things that you think we miss addressing and that we haven't heard of yet that are important to highlight in the work from these 3 regions?
Well, it's not only these three regions, but what I see is that, for instance, it's stressed from in the interviews from North Jutland as well as in Exeter, they have devoted a specific position for technology responsibility, technology nurse. So I think technology stress could actually be something that we need to think carefully about. But the other thing is the digital stress. When we now start collect data from self-monitoring and you get data on the table that you have to address, is that causing another stress on these workers that we are so keen on keeping in this? So,
and just to make sure that I understand you correct, the technical stress is the fact that when we rely on new solutions, we need to make sure that they actually work, and if they don't, we get a feeling of stress. And the digital stress is more about the need to actually make decisions and use all the data we have available.
Exactly. Exactly.
Helen, if we go to you in Northern Jutland, how do you see? I mean, this is very much a positive story and a positive picture of all the good things that you're doing and how you're using new technologies to develop your healthcare system. And also you said that you can probably use this even more in recruiting in the future. Do you agree with Niklas that we also need to be very curious and very focused on the digital stress or the risk for digital stress now that we have all these new possibilities?
Yes, I think we should be, because the healthcare personnel should concentrate on delivering healthcare. So we have to take away the stress of the using the digital services, either working or not. What we did in North Jutland was that we created this joint secretary that are responsible for delivering all services to all municipalities and hospitals concerning all the technology and the use of technology, providing educational programs for healthcare professionals, providing support for healthcare professionals using the technologies and for the patients as well. So we have to move some of the stress away from the healthcare professionals and giving this responsibility for us, in our example, to a joint secretariat.
Katja, in Exeter, you've chosen the same way of organizing it, where you have a general secretariat. Is that out from the same thinking that you need to deal with the technology so that the healthcare workers can focus more specifically on the care and the daily tasks?
Yes, that's true. We have this, like Niklas mentioned, these technology nurses who make some installations and give technological support, and also train the professionals to use the system and helps when it's needed. And that's the reason that all the nurses cannot deal with these issues and the stress what this could bring. So it makes life more easier.
It makes life more easy. That's a very good way, I think, to sum it up. I've heard you talking about many good stories, a potential to use this even more in recruitment. Then, as you mentioned, Niklas, now also a focus on the risk for digital stress, so that we actually make sure that healthcare professionals spend the time on what they're best on, becoming superheroes in that regard. Time is running. Thank you all very much for joining us, for sharing your insights and your experiences from Exeter, from Sogn og Fjordane, and from Nordjylland. And I know that in some of the work that Niklas is doing, there will also be even more about all the good work you are doing. So thank you all very, very much. Det er dags at bytte språk igen, for at vi skal til at runde av den her dagen og den her dagens konferens. Jeg uppfattar i alla fall vi har fått med oss jättemycket inspiration, jättemånga goda exempel från hela Norden, eller i alla fall jättemånga ställen runt om i Norden, både när det gäller utmaningar men inte minst lösningar för att skapa bättre välfärd i tyndt befolkade områden. Innan vi slutter den her dagen helt, så har vi fået en hälsning fra den danske social- og indenrigsministeren Astrid Krag, som jo også er fra det danske ordførendeskabet for Nordiska Ministerrådet. Og den tænkte jeg, at vi skulle dele med os, inden vi slutter. Jeg tror, den kommer her.
Kære alle, jeg er ked af, at jeg ikke kunne være med live i dag, nu hvor Danmark har formandskabet for Nordisk Ministerråd, men arbejdet i parlamentet skal jo passes. Derfor så får I den her videohilsen fra mig. Her i København, hvor jeg befinder mig, er der ikke langt mellem lægehuse, sygehuse og andre velfærdstilbud. Men tager man uden for byen, længere ud i det danske land, ja, så er billedet et andet. Mange steder kæmper man med at finde en læge, der vil købe den lokale lægepraksis. Nogle steder findes sådan en, ikke mere. Det lokale sygehus er måske også lukket. Ligesom andre sociale og velfærdstilbud er det. Det er et billede, som I også genkender i resten af Norden. Velfærden klumper sig sammen i de større byer. Og som denne her konference slår fast, det kan være svært at finde og fastholde medarbejdere til den velfærd, som trods alt stadig findes i yderområderne i vores lande. Det er godt at opleve, at I er så engagerede i at løse de udfordringer. Men vi må også være ærlige og svare på, hvor en væsentlig del af ansvaret ligger. Ansvaret for, at der er god velfærd i hele Norden, ligger især hos mig og mine nordiske politikerkolleger. I mine øjne er der ingen tvivl om, at udviklingen er et resultat af politiske valg truffet gennem de senere år. Noget af udviklingen skyldes selvfølgelig også urbaniseringen, at flere flytter til de større byer. Men de politiske valg, vi har truffet, og dem vi træffer i fremtiden, gør en forskel. Her i Danmark har forrige regeringer i årevis haft fokus på at centralisere velfærdstilbud og uddannelser i de større byer. Et eksempel. Mange lokale sygehuse er lukket. I stedet bygger man nye supersygehuse længere væk fra borgerne. Centralisering er selvfølgelig ikke entydigt dårligt. De store sygehuse er også mere specialiserede, og det er godt. Men vi må ikke glemme, at en stor del af borgerne altså bor uden for de større byer. Er det rimeligt, at de ikke får samme del i velfærden, blot fordi de bor uden for en større by? Er det rimeligt, at ens postnummer afgør kvaliteten af den hjælp, man får fra vores velfærdssystem? Vi politikere, vi har stadig et valg. Vi kan ikke rulle udviklingen helt tilbage, men vi kan føre en politik, der udvikler yderområderne frem for at afvikle dem. Vi kan stoppe den værste centralisering. Jeg synes, at vi med konferencen her viser, at vi vil udviklingen, også i de mere tyndt befolkede områder. Rundt omkring i vores lande findes der mange gode løsninger, som bidrager til en holdbar velfærd i de tyndt befolkede områder. Jeg kan også forstå, at konferencen her fører til et tættere samarbejde mellem vores landes kommuneforbund. Det synes jeg er meget godt. Men som jeg indledte med at sige, vi politikere må også tage ansvar. Vi har muligheden for at skabe gode rammer for vækst og for et stærkt velfærdssystem i hele Norden, også uden for de større byer. Her i Danmark har regeringen sagt meget klart, at vi vil udvikle velfærden i hele landet. Vi mener, at man skal kunne bo og arbejde overalt i landet. Vi er også klar til at træffe de politiske beslutninger, der gør det muligt. Lad mig komme med et par konkrete forslag. Vi vil åbne nærhospitaler, så sundhedsvæsenet kommer tættere på borgerne i områder, hvor der er langt til det nærmeste sygehus. Vi vil åbne velfærdscentre i byer, hvor centralisering har ført til, at der er blevet langt til velfærdstilbudene. Og vi vil styrke uddannelsesmulighederne uden for de store byer. Vi er ikke viljesløse over for urbaniseringen. Det er muligt at have udvikling, muligheder og velfærd uden for de store byer, hvis vi vil, og hvis vi gør noget for det. Jeg håber, I fortsat vil komme med gode løsninger til, hvordan vi kan bevare og skabe gode velfærdstilbud, også uden for de større byer, og ikke mindst, at I vil holde os politikere op på det. Tak for ordet.
Och tack för det här budskapet för den danska social- och inrikesministern. Det finns alltså också en politisk uppmärksamhet och vilja till att lösa de utmaningar vi står inför. Og med det positive budskabet, så vil jeg gerne runde af den her dagen og takke for os her på Folkets Hus i Stockholm. Vi vil også takke vores dygtige tolker, som har kæmpet igennem hele dagen for at se til, at der funnits mulighed for at tilgå den her konferensen på olika sprog. Tak for det også. Den her konferensen var arrangeret af Nordens Velfærdscenter i samarbejde med Nordiska og Glesbygdsmedicinsk Centrum förutom det danske Social- og Indenrigsdepartement. Og som jeg så i början, så har vi spillet ind alle sektioner under dagen, og dem kommer vi at dele med jer på Nordens Velfærdscenter sin YouTube-kanal. Vi kommer også at få et udskick med länker og en masse andre saker fra dagen i dag, herunder også de præsentationer, som har delet. Dela gärna med jer det, som ni tyckte var vigtigst till en kollega eller en annan som inte var här, för det finns alltså möjlighet för att tillgå allt detta. Och sen är det bara att säga tack för idag.